Well, hello, everybody. My name is Melissa Mazor, and I am a nurse scientist in the Community Outreach and Engagement Program at the Tisch Cancer Institute. And I am so delighted to be with all of you today. So to start, if we can go around and please introduce yourself and provide just a very brief background about yourself and your role in cancer care.
Hello, everyone. My name is Christian Rolfo. I'm a professor in medicine at the Sinai Icahn School of Medicine at Mount Sinai, and I'm the Associate Director for Clinical Research at the Center of Thoracic Oncology. My focus of interest is cancer care for thoracic oncology patients, and also specifically, I'm working in drug development and biomarkers in liquid biopsy.
Hi, I'm Dolores Moorehead, and I work for the Women's Cancer Resource Center, where I am a community engagement director and client support clinician. And what that includes is I provide patient navigation to our clients that we serve. I also provide therapy to them and lead support groups and work with different researchers around the needs of diverse populations.
Hello, everybody. I'm Lavern McDonald, and I'm a community scientist for the Icahn School Mount Sinai Project. I'm also a social studies teacher at a small independent school in Manhattan, and I was diagnosed with lung cancer in 2018. I think that often when somebody gets a cancer diagnosis, they often look at it as a bit of a death sentence. And what we know is that with all of the new treatment agents, that many people are actually having long-term survivorship and are enjoying high quality of life. And I'd really, if I could, invite primary care physicians and specialists, oncologists, the multidisciplinary teams to really center this kind of reality that people are in fact having access to quality treatments and are enjoying and are having, as I said, good quality of life.
So sometimes we have some patients that are going, for example, with the first diagnosis to the emergency room, or they back to their doctors with some of these papers that they have results, and they give a very bad prognosis and bad ideas what the cancer really is based in their own education that was maybe very limited on the topic. So we need to be very careful because sometimes we are facing this misinformation is conducting to and non-willing to do nothing. Some patients, they say, I will die, I don't need to do this, or it's very toxic. My doctor told me that it's very toxic, or I heard in the emergency that I have some months of life. So these kind of things, we need to educate everyone. Cancer is affecting a big part of our population, and it's something that will be taking part of different branch of medicine. So we cannot in 2022 miscommunicate or misinformate patients about this, and this is also causing another kind of disparities as well.
I particularly feel it's important for communities of color not to receive the worst news, because that's what ends up sticking. And I also feel like if we could understand the importance of allowing someone to see someone who looks like them and knows that longevity is possible, quality of life is possible. It's important because that's what gives hope. It's in addition to the doctor and the medical team talking, I've seen what gives someone hope is that they're excited when they see this person who's past where they are and can share their experience, because it also takes away some of the fear. And that's how you get spokespeople to say, this is how my experience is. I just find it's important. I like to bring someone in when I have a talk that is able to say, here's my experience. And it's not the doom and gloom experience, because everyone's already afraid of that. It's the, look, I was given this diagnosis and I participated in a clinical trial. I'm stage 4 and I'm 4 years out. I'm 5 years out. I'm 7 years out. And actually, I'm enjoying life. So I feel like if we could figure out ways to increase that visibility along with education And along with doctors and researchers understanding, you bring people to the table and you educate them, because then they can make informed decisions. And then you bring the family there, because they then become a mouthpiece out into the community as well.
Mm.